The health system is one of essential socio-economic activities. It requires rational and effective management. With that, our group has decided to create an application that can assist frontliners during these hard times. Padayon, gabay sa kalusugan. Hospitals, as the main actors of the health system, generate an essential volume of information, but it's not available in the necessary time and manner.
Millions of healthcare workers have faced the challenge of providing care for patients with COVID-19. While often ill-equipped and poorly prepared, risking their own lives to save the lives of others. They honor us all with their commitment, dedication, and professionalism. It has placed frontline workers under immense and unprecedented pressure, putting their physical well-being at risk. Understanding these issues, Padayon aims to support frontliners. With the help of health information systems, it will help improve the quality of life of people in all sectors of our society.
Make healthcare more accessible by allowing real-time access to shared data, reducing the possibility of overlapping medical records and errors through a single platform.
Padayon, gabay sa kalusugan.
Padayon aims to help frontliners to optimize and digitize the medical records and current situations of COVID-19 patients in isolation centers and hospitals. Keep track of their records, automating the process of filling out medical records and speeding up the patient registration process. A medium of communication between frontliners.
Padayon comes with important features that aim to make keeping medical records and monitoring COVID-19 patients easier, faster, and contactless for frontliners.
When you open up the application, the first thing you see is the splash screen and a form telling you to log in. Once you are done filling up your username and your password, you are now greeted with the summary page of our application. The summary page summarizes the information of patients that the doctors have added into the application. This page will give you the info of what are the ages of those said patients, the most frequent symptoms that the patients have, and along with the underlying conditions. So, although there are already numbers in the X and Y axis, if you hover over the bars in the graphs, you would see the labels as well. Next up is the patients page. On the left side, you could see a list of patients. Whenever you click a name, a page will pop up on the right side revealing their information. It contains patients' information from their name, age, underlying condition, current situation, and their daily medical records during their isolation. Also here, if frontliners are already checking or monitoring their patient that day, they can input the record of their patient that day. So they can consistently update the patient's records. To add a patient, click the Add Patient button, which allows you to open up a form and fill up the necessary information of that new patient. Let's zoom in to get a better view of what the information to place. Once you're done filling up the necessary information of your patient, you will be notified by a message box that the patient page will be updated together with the patient added from the form. On the other hand, if a frontliner wants to discharge a patient, you could just click the discharge button on the upper right of the application.
Next, The Messages page. This Messages page allows communication between the frontliners. They can ask for consultation, assistance, or any medical related conversation they need to have. A profile page. The doctors that are going to use it to better identify them along with the other users of the application. The profile page will have the user's contact info along with their address, field of expertise in the field of medicine, assigned isolation center and what hospital they are residing in. This page also tells the age, date of birth, number of logins, and number of patients that the user is currently helping or taking care of.
To ensure the safety and credibility of the accounts that use the Padayon application, registering as a frontliner or doctor is not a feature that can be accessed by all users. Only the official hospital and isolation center administrations may give and register appropriate Padayon accounts to the frontliners once they are hired. This guarantees that only frontliners who underwent the proper hiring process have access to the medical records of the COVID-19 patients that is in the application.